Welcome. This is Group 6 with Candice Berkhouse, Laarni, Jasmin, and Eva Morales. We are presenting telehealth technology for patient education regarding asthma exacerbation prevention.
Summary of key issues. This presentation will inform our colleagues in administration on the possible implementation of a telehealth system to decrease our asthma readmissions and increase education to our patients. Telehealth is the use of digital information and communication technologies, such as computer and mobile devices, to access healthcare services remotely and manage your healthcare. Healthcare delivered via telephone or internet might not improve the quality of life for people with mild asthma, but it could keep those with severe asthma out of the hospitals, studies have shown. Pros to telehealth include immediate access to a physician versus waiting in the hospital for a physician, less time spent in waiting rooms, reduces the cost of healthcare. Telehealth is cheaper than an in-person office visit versus going to the emergency room. It's convenient for patients who live far from doctors' offices or hospitals. It's easier for patients who are immobile or have difficulty moving around. Patients are more likely to follow through with follow-up appointments due to the convenience of telehealth. Cons to telehealth include the following. A person's primary care provider may not be a telehealth provider, therefore the patient may get a new doctor who does not know much about the patient. A patient's medical history may be compromised as a result. Cost of purchasing software and equipment for providers, along with the time it takes to train providers on using the new technology. Thorough examinations are questionable due to the physician not being able to provide a hands-on assessment in order to do an appropriate diagnosis. Costs from hiring IT staff. Also, the security of medical information could be compromised online. Ensuring confidentiality may be an issue that needs further research as this technology advances. Proposed telehealth technology include virtual appointments, which enable you to see your doctor or a nurse via online video conferencing. The doctor or nurse practitioner can prescribe medications, suggest home care strategies, or recommend additional medical care. Patient portals are another proposed telehealth technology. Online patient portals are used to communicate with your doctor or a nurse, request prescription refills, review test results and summaries of previous visits, schedule appointments, or request appointment reminders. Remote monitoring. It is web-based or mobile apps for uploading and sharing information. Wearable devices that can automatically record and transmit information, such as asthma inhaler use. In the system life cycle, there are 5 steps. The first step is to have a plan. Now, the purpose of telehealth is to allow easier access to healthcare with convenience of staying at home while a patient is sick and seeing a physician regarding health concerns in a timely fashion. The resources needed include computer software and hardware, physician education on equipment utilization, and the employment of IT personnel. The second step is system analysis, which is the performance expectations, including making sure enough providers are available at any time during the day and night to continue a smooth flow of e-visits that are needed. Ensuring the system is accessible to those in remote areas, those using broadband and mobile devices, ensuring the system is easy to navigate, ensuring the security of the system to protect patients' sensitive information. The third step is the design of the system, which is the configuration of the hardware and software to meet the requirements of how the system is meant to function. The architectural design and the technical functions are created during the design phase of the system lifecycle. These attributes determine how effective the system will be for the use of its intended purposes and how user-friendly the system will be. System implementation is the phase in which the system is ready for use. Equipment installation followed by program training will be initiated. Performance testing of the system may be carried out during this phase of the system lifecycle. The last step is the system maintenance. This is the reevaluation of the system's performance. It must be applied in order to enhance and upgrade the system as necessary. A continuum of security enhancements are necessary as well. User feedback from providers and patients along with the statistical data that reveals the patient's outcome can be useful in determining the efficiency of the system.
So some of the issues that might be brought to light and some of the concerns that families might have would be the leaked private information, the reliability of the information that they're being told, and the accessibility. So how easy is this program to get a hold of? How cooperative is the company? Is there any type of way to access these, portals at home? There's a lot of hesitancy about privacy when it comes to personal medical information simply because it is so private, and I think there would be a lot of hesitation letting somebody on the other end of a phone or a computer that we might not know have access to this information that is our health. Some stop gates that we could put up as a healthcare system would be verification processes. So not only could the patient verify the physician on the other end, but the physician could verify that the information is being given to the correct patient. In our scenario, we're talking specifically about asthma. So we would want to make sure that the patient is being told age appropriate. The things that you tell a teenager would probably be different from what you're explaining to a smaller child. The information we have as young adults. So maybe the 20-something-year-olds might respond better than the teenagers. Another thing that would need to be implemented was verifying that the information that we are giving the patients is correct. I know there are a lot of companies that do telehealth type marketing, and there are a lot of ways for this information to get to the public. So we just want to know that before we give something to the patient with our name on it, that it is correct. And then we want to make sure that the information that we're giving to these younger populations experiencing the asthma attacks and exacerbations are understanding, and it is a relatable process. I'm sure chronic asthma patients have heard it all before. So the information we give just needs to be a little bit more relatable. And we could sort through that information with different policies that allow us to accurately check what we're giving. There have been a lot of studies about the usefulness of telehealth in rural areas. One study in particular is from a rural area of Australia, where they had reported a large benefit from telehealth. They said that the access and the quality of clinical care available through the telehealth medicine contributed to a lot of health disparities, ending. And the professionals reported that they enjoyed the opportunity to work with specialists that they might not have been able to work with because it was such a rural area. There have been several studies that have stated the same thing over the last decade or so. There have been several studies on the readmission rate when implementing telehealth. One specific study that I've linked has stated that the 3 facilities that studied this, the readmissions decreased anywhere from 4 to 7%, and pneumonia readmissions decreased by 26%. One facility's overnight stays decreased by 40% because of the implementation of the telehealth equipment. One facility even recorded saving as much as $1.2 million in a fiscal year. If you Google ways to implement telehealth to patients and staff, pages and pages and pages of creative ways to get the idea across for patients and staff alike pop up. A couple of fun ideas that facilities could use to get the ball rolling would be marketing. So letting the patients know that this option is available to them and letting them know that it is there. There are a couple of hospitals that have training guides to their computers before the patient is allowed to use the computer. So that would be one way to get the patients aware. We could send out brochures. We could send flyers in the mail. If it's a rural area, then I'm sure everybody is checking the mail often. As far as the staff goes, there would have to be in-house training so that they not only were aware of what telehealth was offering, but how to use it and how to teach our patients to use it as well.
Potential issues in development and maintenance. Patients' level of understanding may be an issue if their level of education is poor, like literacy with being able to read, or disability as well with hearing and vision. Their ability to understand technology and their current health issue, like asthma and prevention of exacerbating it, is important in determining the success of utilizing a telehealth system. For example, a patient that cannot read may not be able to understand the steps that are shown on the screen on the computer or the phone app and able to access their physician over the internet through telehealth. This will hinder the plan of preventing readmission and assisting in providing education at home before health issue has worsened. Compliance with personal interactions are taken away with the use of technology, and compliance are usually supported with a rapport that the provider and patient gets to have during a visit. Utilizing telehealth for education of asthma, especially in the young demographics, make it easier for the provider or educator to lose their attention when they are not in the same room or vicinity. Compliance may be less supported on proper use of their inhaler, when to call for help, and other important guidelines in asthma exacerbation prevention if the patient is not paying attention because they're in another room and they're distracted much easier. Finances. Patients living in rural areas may be limited financially in being able to acquire computers to be able to get on the internet or paying for internet service. Another financial issue will be paying for the telehealth visit, which some patients may not be comfortable with doing in paying with a credit card online. Technological devices. Again, financial costs of the device and software can be costly. In conclusion, there is a potential decrease of readmission within 30 days for asthma exacerbation with use of telehealth due to the convenience, due to time saved by providing quicker access to provider with less wait time and convenience of being at home and not driving to and from the hospital for the patient. Financial costs may be less compared to physical visit made with copay to the ER for the patients. Hospitals have less out-of-pocket costs for readmission within 30 days from patients due to asthma exacerbation, and for the staffing and supplies utilized from patients' physical visits needs. Promotion of education of asthma and signs of symptoms of exacerbation prior to readmission can be made easier and faster through telehealth. Although the risks of patients' privacy may be increased with health records available online due to ongoing hackers and computer viruses, providing encrypted sites and continuous management of software can minimize those concerns. Reliability of internet access and device to use may be potential issues in promoting telehealth use in rural areas. However, it may create a boost of use with newer technology changing daily and youth-relatedness in education provided. If you have any questions, please write us a comment below or send a message through the inbox in Canvas. Thank you.